Mr. Rasmussen. My name's Carrie. I'm an OTP student. I'll be working with you today. What would you like to be called?
Paul's fine.
Paul? All right, well, right this way, Paul. I hear you're having some trouble with your left shoulder.
Correct.
Okay, so go ahead and take a seat here for me. We're going to do two things with you today. Manual muscle testing, which will allow me to evaluate the strength of that muscle or group of muscles, and I'll give that a grade of 0 through 5. And then I'm going to use this little tool here. It's called a goniometer. Don't worry, it doesn't hurt. And that's going to give you a measurement. We'll check out your active range of motion. So that's motion that you're doing. And that'll kind of give us a baseline. We'll be able to use those measurements as you go through therapy to make sure you're progressing. Does all that sound okay?
Yeah.
Okay. So first, I'm going to measure your horizontal abduction, which is your ability to pull your arm backwards like this. So to do that, I'm going to have you lay down on your belly, which is called the prone position. And you put your arm out this way and pull it up, and I'm going to press down, and I want you to try and resist me, okay? So go ahead and lay down. Okay, so when we do this, we're checking on your posterior fibers of your deltoid, and that originates from the spine of your scapula. So I'm going to stabilize your scapula, and I'll resist you right here. So go ahead and try and resist me as I push down. Ready? 1, 2, 3. Very good. Relax. All right. You did that fairly easily against maximum resistance, so that would be a grade of 5. Now, if you'll go ahead and roll over onto your back, we're going to check your horizontal adduction, which is pulling it in front of your body. Okay, so go ahead and just bend your elbow here. And I'm once again going to try and resist. I want you to try and resist me pulling it back this way, okay? And this is dealing with your pectoralis major, which is right here. You've got two heads, a sternal head, which is at your sternum, and a clavicular head, which is at your clavicle, okay? So go ahead and bring it up to the front. Very good. And try and resist me, okay? And 1, 2, 3. Very good, and relax. And you did that against maximum resistance as well. So that would be a grade of 5. So that's awesome. If you weren't able to do that, we would put you in a gravity eliminated position, which would be sitting, and you would just bring it in and bring it back. So I'm actually going to have you come up, and we're going to move on to goniometry now.
Okay.
So if you'll take a seat on the chair over here, I'm going to use my goniometer and check all this out, okay? I'm going to have the axis at your acromion process, and then the stable arm is going to be parallel to the floor or perpendicular to your body, and the movable arm is going to follow the longitudinal axis of your humerus, okay? And I want you to go as far as you can forward. This is adduction without any pain or cramping, and make sure not to twist that body, okay? No cheating. Go ahead and put your arm up, not your acromion process, and go ahead, move it forward. Very good. Is that all you got for me?
Yes.
All right, go ahead and relax. Bring me down. Okay, you are at about 119, which is just shy of the normal range of motion, so you do have a little bit of work to do there. And now we're going to go ahead and test your abduction, okay? So we're going to use the same position of the goniometer, and go ahead and bring it backwards. You're twisting your body. Okay, try again. Go ahead. All right, there you go. Relax. And that has you at 45 degrees, which is within normal range. So we obviously need to work on bringing it forward, that horizontal adduction. But do you have any questions, comments, concerns for me?
Nope.
Okay, so I will put that in your chart, and you're all done for the day.
Fine.
Have a great day.